So for anyone that's logged on and listening in on this webinar, I want to say thank you so much for joining us. Again, this is very, very live. So apologies ahead of time if I make any mistakes or if I sound like I'm a little jittery from all the coffee I've had this morning, because it's kind of bad. I would like to first just, again, welcome and thank everyone for joining us, and then introduce myself for all of those who have not met me yet or don't know who I am or are wondering, why am I talking? My name is Jessica Caver, and I am an account executive at Linguava, which is a language service provider here in Portland. We've had conversations leading up to this webinar about what are some talking points that we want to go over together. What are some things that we want to hit upon, and realizing that, wow, it's a lot. There's a lot of challenges in health equity, and I don't know if we can even capture that. So really this webinar today is going to be a very organic conversation, very real conversation, and we're going to pack it together through our lived experiences. We're going to talk about really how COVID-19 has both unveiled and added to the health disparities, primarily within communities of color, Black and Brown communities. So we're going to be super real, and we're not going to hold back on it. When I originally was talking to my guests, which I will introduce both of them in just a minute, and leading up to this, I had mentioned, okay, but we aren't the experts. Do we still feel valid talking about this? And one of my guests talked, you'll meet her in a second, really called me out, stopped me pretty quickly, and held me accountable for my words and said, wait a second, who said you have to be the expert in something to have a talk about your lived experiences? So thank you, Talk. This reminded me that we do not need to be the experts when we have those lived experiences. We are the experts through our lived experiences. So let me reframe that. We might not be the experts by means of having a doctorate degree, but we are the experts with our lived experiences, and that's why we are here today to talk about this. I'd like everyone to use the chat function. While I can't see it, we would love to filter your questions. They will be sent to me when appropriate, and at the end, we'll have about 10 to 15 minutes to answer those. So if they're general, type them in. If they're directed at any of us specifically, please put that in your notes. All right, so our guest today, Sonale Gillespie. Super excited to have her on. She's Social Service Manager for Population Health at Care Oregon. She is a 1.5 generation refugee. She's in a position with Care Oregon that bridges between the healthcare industry and the community. So she's got a very unique position within there. And we're really excited for her to share her lived experiences in this conversation. So thanks, Tuck, for joining us. And then we also have Eric Hinman, Director of Sales at Linguava. I work with him. And while he might not look like us or have the same lived experiences as us, really, as two women of color, Talk and I, we don't have the same experiences. And we really felt like it'd be important to have Eric as our white male ally come into the conversation. We so often talk about holding our white friends and our white counterparts accountable for having these conversations with them, their white family and their white counterparts and their white friends. But we have to first have that conversation with them. We're going to hold them accountable to continue it. So that's why I'm really excited to talk with both Talk and Eric. My first question before we even jump in is, I want to know why both of you joined the conversation. What made you think, like, yeah, okay, I've been invited, I want to do this? So Talk, give us a little bit about that.
Yeah, so Vivi, good morning, Eric and Jessica. I just first want to say thank you for having me. To answer your question, whenever I'm asked and invited to be part of speaking engagements or, really unique platforms like this, I have to tell myself that I'm not here for myself. So what I mean by that is, whenever I'm given opportunities like this, it's an opportunity for me to bring the faces, right, of the refugee and immigrant community and communities of color. It's an opportunity for me to elevate their voices and bring visibility to their experiences. While I can't speak for them, I hope that when I show up to these spaces, A, that you hear my heart, and that secondly, I am bringing with me the things that my community has taught me, things that my parents have taught me, and things that my ancestors, all those who have sacrificed so that I can be here, all those who have helped shape my learning and my growing. That's why I show up to these spaces. And again, I'm just so grateful that you guys invited me.
I love that you said for us to hear your heart. We've talked about that before, especially just as women of color. We so often feel unseen is the word. And recently I'm going to throw this in because it's really important. And again, we're live, we're real, we're unfiltered. I recently lost my stepmother, and it's been really hard for me, and we know this. And I'm currently at my dad's house, staying with him, so I'm feeling a little bit removed from my real life. And I've talked about this a little bit on a previous video chat, again with my two counterparts, Eric and Talk. And afterwards, Talk, you had sent me a text, and it was really simple, but it was, the equivalent of a book that got sent to me, and all it said was, "I see you." And there was a heart emoji, and it made me cry because so often I feel unseen, and that we hide our pain because we're portrayed as, for myself, a strong Black woman, which I am, but I have feelings and emotions. And so thank you. That hit me in the heart, and I wanted to say that on our live broadcast. Eric, I'm going to turn it over to you because I also want to know why are you here? I've told everyone a little bit about why we feel it's important, but why do you feel it's important for you, and what made you decide to join this conversation?
Yeah, absolutely. Thank you. Hey, everyone. I'm down here in the bottom right corner. This is a really, I think, very difficult conversation for us as different groups of people to come together and have. In fact, in the research that Talk and Jess and I have done in preparation for this webinar, it's only become more glaring to me that the issue is, there is a gap, and it's really the conversation about bridging that gap. So I want to join this conversation as just that added perspective, try to make it more attainable, as you said, for people that look more like me, to be able to be better allies and advocates. And so I think that starts with, really asking the honest questions and addressing the, ignorance or lack of exposure or lack of lived experiences. So that's why I want to be here, is to represent that group and make sure that, for all that are watching, we're able to take away whatever we can because of our, conversation and bridging the gap between our lived experiences.
Perfect. Well,
Jessica, we can't see you. Talk about visibility.
Wow.
Disappeared.
Okay, so that's really funny. Thanks, Doc, for calling me out, because I think I did the same thing on our test run on this platform. Definitely thought I was on mute, but I just covered up my computer video. So
I like to think that we're calling each other up, right? Like yeah. Van Jones says, let's call each other up.
That's why I love you. Yeah. We are calling each other up. So thank you. Yeah. I was like, oh, did I disappear? It just that Eric talking and now he's on my screen. I don't know. So thank you. My video should be back on. And Eric, thank you for sharing why you're a part of this too. We're excited to have you. And I just personally was excited to have you because I already work with you and I know you're a pretty gem of a guy. Okay, let's jump into this. Our first topic is, how has COVID-19 negatively impacted communities of color? The first thing that I thought of when that question came up was a video that I had seen on YouTube. I don't remember if I just randomly came across it or someone sent it to me, but I think it's just simply called COVID-19. I believe Eric is going to make it available in the webinar chat, so that there should be a link to it. You can watch it either now or after. But really, it's a mashup montage of all the commercials for COVID-19. Everyone has seen them. We've all been stuck in the house for months. So we've all been watching TV. Okay, we know. All of these commercials mashed up into one, talking about the similarities in the message from all these large corporations and companies, down to the piano music, down to the messages. Our company started, from 1918, from this year, for 45 years, all kind of sounding exactly the same, down to the visuals and marketing of the actual commercial, all being really, really similar, if not to a T exactly the same. Big matchup of all those. But the main thing that I took away from that mashup is that the message of every single one of those advertisements was, we're in this together. That's what I want to unpack with how COVID-19 negatively impacted communities of color, is that specific line, we're in this together. Are we really in this together? So talk. I want to first throw it over to you. Unpack that statement for me.
Oh, so for those who have been in conversation with me these past several months, they know this. They know I've been saying this over and over. And that phrase for me, gosh, it's not that it's not true. I just know that there's so many layers underneath that, right? So I want to give respect and honor to those who came up with this slogan. I see where we're trying to go with this slogan, and I want to lean in gently and ask us to take a few steps back and let's really break it down just for a second, right? So when I see that phrase, I say, oh my gosh, how can that be possible when we already know that there are deep, right, historic, rooted racial and structural inequalities that's embedded, right, that is inherent in its design. So what happens is there are just the haves and the have-nots, right? And then even in between that, there's just so many layers. I mean, let's think about this. I mean, our history and research already shows that communities of color are disproportionately impacted by health disparities. That's a start. And then what COVID did was it peeled back the layers and kind of just threw it all in our faces, right? And it was like, here it is. Of course, it's going to impact communities of color differently, right? Because we are already experiencing these health disparities. And then there's people who don't even have their unemployment yet, who are still waiting. I think there's thousands out there still waiting. And you've got phrases like shelter in place, which we have to. We have to shelter in place. And yet, in communities that I'm a part of, we have multi-generational families living in really tight quarters, right? And then don't even get me started on the mask part, right? The face mask. I mean, I remember when face masks first came out. I remember people saying, oh, we have all sorts of different designs and all sorts of different colors, and really like pick whichever one you want. And I had this moment of like, oh, even that statement, right? Not everybody has the choice to pick whichever they want. And I'm not even talking about affordability, right? I'm talking about design. I think of our Black brothers and sisters who can't just, particularly our Black men, they can't just go and pick up a red bandana type or a blue bandana type mask, right? They can't pick things that already are going to add to how they're seen in society. So anyways, that's a lot. You can imagine I can go on for days, right, Jessica and Eric, so I'm just going to keep it to that. But I do want to say that I'm not angry at the we're all in this together slogan. It just made me think, are we really in this together? And is it more about we're not all equally in this together, right? I don't know. And English for me is such a fascinating language. Like you change it up a little bit and it like changes the meaning. So
yeah, thank you. There is a lot. You can probably see my eyes moving to the side, but I'm taking some notes on what you're saying because I don't want to miss anything, and I want to come back to a couple of those things. You mentioned unemployment. That's funny because I took a furlough for the month of April for a whole month, and actually just before we started this webinar, I got a text alert that I got one of my unemployment checks loaded onto the prepaid and retail card. So I thought that was kind of ironic. That was April, and it's now July 16th. So I'm fortunate enough in my personal life to have been already caught up on bills and keeping afloat. But what you mentioned, all those the disparities already within the community, all those people that are really relying on that for it to take a couple of months to get one check, and we're not equally all in this together. So I liked how you corrected that statement. So thank you. You also previously had mentioned historical, disparities. that also play into the trust part of the healthcare system within communities, Black and Brown, primarily within Black communities. And we can go back to, the Tuskegee syphilis experiment in Alabama, where they were, experimenting with, actually giving syphilis to Black men and then putting them in a program to test, vaccines and medications. But really, they were placebo pills, and what they were actually testing and experimenting with was the effects that the disease had on the body, all the way from the first point of infection to death, and the gruesome effects that had. Having that all caught, so that they could then test actual medications and vaccines on white men, based off of the effects that the disease had on Black men. So there's that, and we could go even much further than that with the use of Black bodies, being stolen from their graves and used as cadavers. And so you brought up several valid points. So I just wanted to say thank you, and we're going to come back to a lot of those. The one that I want to circle back to you, Eric, is Talk mentioned the face mask, and this being one of the parts that's not equal in the we're all in this together. She mentioned the red and blue, I believe, the different colored bandanas. We can't just go out and put a bandana around our face and not expect to be looked at kind of funky, right? We don't do that. We already know. So what kind of mask would you think that we can wear without feeling uncomfortable? But this also plays into this mistrust that we have in the healthcare system. So is coronavirus and COVID-19 a real thing? This is a question that comes up in Black and Brown communities a lot. And this is where, Eric, I want you to chime in. You had shared something with me recently, and it really plays into this question of, is it real or is it not? And why is there a mistrust? But also ties back to Talk's comment about face masks.
Yeah. Yeah, absolutely. Thank you. So in doing some research, especially overlapping the political movement of masks being an infringement on my freedom, one of our coastal counties on their mask requirements website, had all the standard mask exceptions that you might see. If you're a child under 12, if you have respiratory conditions, if you have a physical impairment that would cause you to not be able to wear a mask. But then the one that was really odd and unique is if you're a person of color and you feel oppressed by wearing a mask, then you shouldn't wear a mask in public. So yeah, let me give that right back to you for your thoughts.
Yeah, sorry, I was on mute for a second. So in case you didn't catch that, this website mentioned the importance of wearing masks and that it was required unless you're a person of color within the community and you don't feel comfortable wearing one. That right in and of itself is a lot to unpack. And that plays into, again, this mistrust that we have within the healthcare industry as a whole. Is the virus so deadly that we have to protect ourselves, social distance, and wear a mask? Or is it not so deadly that Black and Brown people don't have to wear a mask and they'll be okay? So I want you guys to sit on that for a little bit.
I think we'll be sitting on that for a long time.
Yeah. I've been sitting on it for a while. It's a lot of conversation for me and my family, my household, with my friends, and it comes up in all different topics too. And I mentioned earlier how I have recently lost my stepmother, and the topic of death has been in my family now for a couple of weeks. And I was having a conversation with my brother, who really keeps me honest, much like you do, Talk, calling me out on, just holding myself accountable for things that I'm saying and how I'm feeling. And we were trying to talk about what are our plans for afterlife, and are we going to be cremated? What are we going to do, just so we can, not have to go through what we've been going through the last couple weeks again. And I mentioned I was going to be an organ donor, and my brother was immediately like, "Heck no, not doing it." And it was stemming from I want them to resuscitate me if I can survive. And if I'm an organ donor, they're not going to. Well, you guys know that that's not a thing, right? In the healthcare industry, is that they legally have to, if you could be saved, they have to resuscitate you unless your wishes are not to be resuscitated. But in a community like ours, and some of the things that I've shared with you, historical events and just in the history of Black and brown bodies, that is a real fear that we have and still have. So it just plays into that: what's real and what's not, and who do we trust and who do we listen to. This makes me think of another conversation. I'm gonna turn it over to you about your position within the community. You kind of teeter a line in your position at Care Oregon, where you, as a woman of color and a refugee, have one foot in the community, but you also have one foot in the healthcare system, working for Care Oregon. What are some things that you've seen that have been surprising you from both sides? And you've seen, I know, a lot of mistrust within the community. Can you unpack that for us a little bit?
Well, I've seen a lot in the healthcare system. And for those who may not know, I am really, really new. I'm a baby compared to my colleagues. I've only been at Care Oregon for 3 years. And prior to that, I've been in social justice work and working with refugees and immigrants, particularly refugee resettlement. And it was such an eye-opener for me, and it still is. For any of my colleagues who are listening, you guys know I go in to work and I am like eyes wide open because I'm learning so much about this really big, complex, and in many ways intimidating system, right? So what I did was I started to kind of just sit back and listen to the small things, because for somebody who comes from the refugee community, these small things are things that we didn't know about. For example, my first week at Care Oregon, I learned about non-emergent medical transport. I was like, oh my gosh, what is this thing? And they're like, it's a benefit. Under Medicaid, it helps, get members to their doctor's office, or, their behavioral health visit, the dentist office. So, to help reduce the cost of no-shows and whatnot. And I think it was like the next day I started, texting all my colleagues, and I was like, why are we running around begging volunteers or family members to help get our families to the doctor's office? Why are we doing that when there's this benefit? So that's one example of how information is there, and yet somehow in the community, it feels like it's hidden. It feels like it's purposely tucked away. And what I've learned in working with my incredible colleagues at Care Oregon and in the healthcare system is that it's not tucked away. It's there. In fact, it's on the website, right? In fact, we have flyers. In fact, we do outreach. And yet community still doesn't know about it. So what I've been able to really figure out for myself, and then I'm slowly coming out of my shell to share this idea that I have, but I'm still, again, a little intimidated, well, a lot intimidated, because the healthcare system uses really fancy language, vocabulary I'm not familiar with. So I'm continuing to channel Dr. Brene Brown, to channel my ancestors, and to give myself confidence to be able to ask these questions of why is it not getting to community. So what I'm referring to is connection. So while my colleagues in the healthcare system are working really hard to get information out, whether it's YouTube videos, whether it's translated materials, again, it's still not getting here. So I see myself in some ways like a bridge, and I see community asking for things. I see community asking for all of these things that are already covered, even oral health, right? Even durable medical equipment like crutches and wheelchairs. These are items that are covered under Medicaid, but we still have community members borrowing crutches and wheelchairs from each other, going to their churches, to their mosques, to their temples, and asking for these items. So I just feel like there's so much opportunity for there to be some bridging. And I know we often use the word bridge the gap, but I like to think of it as bridging opportunity. There's so much that we can do together. And that's why I cannot express enough, Eric, that you're on this call with us. Not that you represent all white people. Again, like I can't represent all people of color, neither can you, Jessica. That's not what we're saying. But to have an ally, right, really be here to help, to first hear what we're talking about, but then also help us kind of figure out ways to get inside, because the white system is going to hear you differently. You know, in some ways, I need my white colleagues to co-sign what I'm saying. And I want to give gratitude to Alim, our other Linguava, you guys' other Linguava teammate, right, who came up with that phrase, right? Like, so anyways, and what I forgot to mention too, Jessica, was that I am a storyteller. I'm very circular. I'm not linear like most folks in the Western world. So I had to kind of break it down like that. So if I lost anybody, feel free to chat in and say you lost this talk.
You know what, Talk, thank you. I actually was going to mention that anyone that knows me knows that I'm pretty long-winded, and Talk, you and I, just from these conversations that we've had leading up to this, and, you know, touch points on, you know, what are some of our talking points going to be, they haven't been an hour-long call. They've been hours long, because we speak in the form of storytelling. It's not, you know, a topic that's just a topic. It's a topic, here's what we know about it, again, from our lived experience, which is going to be a story. And that's really where we've done all of our knowledge gaining and our knowledge sharing. This isn't stuff that we've learned, well, I'm speaking for myself, I guess, learned it in school. A lot of the history that I might mention on this call, or, you know, a lot of the facts that I might mention are not facts that I learned in school, but through self-education, through conversations with my family, through conversations with other friends, with other Black and Brown people in my community, and just talking about it together. So we're probably going to do a lot more of that in the time that we have left as well. Eric, I do want to pass it to you, though, on the same question that I tossed to Talk. You are now in a role at Linguava where you have a foot in the healthcare system, because we're working primarily with medical providers, but you're also now working with the LEP community, and specifically trying to find health equity through language access. Can you tell me a little bit of what you've discovered in your role since you've joined Linguava, about what that looks like, and some things that you've learned about specifically the LEP community and the disparities that we have there? And again, we work with a lot of refugees. We work with a lot of non-English speaking communities of all different backgrounds, cultures, and languages.
Mm-hmm. Yeah, absolutely. So again, what we at Linguava try to do is have a conversation with our partners in the clinics and hospitals to help them visualize and address and bridge as much health equity as possible from that language access lens. And so we're really diving in deep and inspecting, you know, where those gaps, both culturally, but also just, you know, functionally from a language perspective, exist. And it's been, you know, really eye-opening. We talk about me bringing the perspective of the dominant paradigm to the discussion. You know, it's not a destination. You haven't arrived at this enlightenment and full perspective. It's, you know, it's always built on, you know, whatever bubble of ignorance that we might have lived in until we realize the world's a little bit bigger than that bubble. And then, you know, we keep expanding out. But you know, it's been really interesting. What I've observed, as you know, I've observed in my entire career, humans try to take the path of least resistance. You know, there's a million different things that are being asked of any of us. You know, the board is asking for specific things, and so when it comes down to you know, limited resources and time, it's really easy for us to seek out the biggest leverage for the, you know, least amount of work, right? And try to, you know, move mountains. And so what we see is, you know, with that friction, if it becomes just a little more abstract or just a little more difficult to understand, just a little bit out of our conceptual reach, that chasm is almost too big to grasp. And so we see, you know, it can be really easy to understand that a patient speaks a different language from you while they're in that appointment. But understanding that they have an entire life outside of this can be really difficult. And then it's like, okay, well, I know I want to be able to provide language access in Spanish, which might be half or more of the different languages that I might encounter. But if there are 200-300 languages out there, where does it stop and what is good enough? And I think that's the real problem, is that question exists. How much is enough so that I've satisfied the need versus who do I need to become to really be there for the communities that need me, and what does health equity look like? So coming back to your question, Jess, with what that looks like, we see things as out of necessity, as horrible as having a relative or even a child interpret for their mother for a really terrible conversation. Going back to your life, Jess, just the past couple of weeks or months, having to be that person and that voice for your family is just such an impediment for any person, for a child to be interpreting for their parent. Not to mention they're not the experts. This is a unique skill set, and to shove somebody without that trained experience into that role can be really damaging. So we've seen that. We've seen, it's just too difficult. Hey, sorry, we don't speak that language. We can't help you. And so now there are patients that don't have access to healthcare. When you talk about the completeness of documents, and if it exists in English, how does a person that doesn't speak English or isn't literate in English, even as English-speaking patients, have access to that information as far as health literacy goes? So it's an entire gambit, and I think really, again, that first step is the attempt is important. It will never be enough, and that's kind of the point, until you have 100% equity for communities.
Yeah, thanks, Eric. You said a couple different things that were really important. One of the things that stuck with me that you mentioned, which I do know, and we've talked about it several times, but that people don't know that they have the right to an interpreter. And oftentimes what we're seeing from our lens when we're reaching out to these medical providers and making sure that they have a language access plan is that they have someone on the staff that is, speaks a little bit of Spanish, or speaks, is bilingual, and it maybe make time for a quick phone call. And then again, worse, that we see these children coming in with their family members to interpret. That one's a really hard one for me, because I've heard really terrible stories about, a mother maybe being diagnosed with cancer, for example, and, her child interpreting that to her. So now you've got, not only the trauma of being diagnosed with cancer, but your child is now having that trauma by proxy of delivering that message to you. And that can be a very hard place. And that made me think, I want to point out that the month of July is Minority Mental Health Awareness Month. We talk about the healthcare industry. We talk about the disparities in Black and Brown communities as it ties back to the healthcare industry. One of the largest and most ignored or unseen portions of that is mental health care. So mental health, amongst Black and Brown people. And I speak to that personally. And we've had a lot of conversations about that. And I want to thank you guys both again for acknowledging that, yeah, it's a very tough place in my life right now. And for me to get onto a webinar and facilitate a conversation where we're talking about health disparities, at one point I did share with you, I felt almost as if I was ignoring my own mental health needs to pull myself up and prepare for this webinar. And that then rolled into that conversation on one of our last calls where it ended with you texting me that I see you. And that is really what part of that mental health is we feel so unseen and like nobody sees our pain and that we're not allowed to portray it or feel emotions. And I want to say specifically, I can't speak on their behalf, but I've had a lot of conversations with my Black male counterparts and friends that Black men specifically have the hardest time talking about their mental health and also having it be a conversation amongst anyone else, almost as if it's not a thing. And they don't believe that a Black man can be depressed. So that's something that I just want to say it here because I know that there are some people on this call that I've personally invited to listen in that we've had that conversation. And so I want to do what Talk did to me, and I want to tell you that I see you. And so I just want to take that moment and use this platform to say that and thank you for listening in and supporting me and joining this conversation because that's what it's about.
I really appreciate you being open to sharing this with the world right now, Jessica. I would be remiss, is that the word? Remiss?
Nailed it.
If I had first mentioned that healthcare covers mental health, first of all, right? Okay, so that is a benefit. Now, in what I've learned from my family and my community and my colleagues is, we do talk about mental health. We just don't talk about it in that traditional white system, right? I see family members and people that I love go to who they trust because that's what it's about, right? It goes back to what we talked about in the very beginning. Because again, as humans, we want to connect, right? That's what it's about. So I see people going to their pastors, even for physical health ailments, right? And of course, mental health. I see them going to their shamans, their Buddhist monks, their imams, right? Those and community leaders that they trust. The traditional white healthcare system is still a little like, and it's more about like, not necessarily do the people who serve me look like me, but again, that structure and how we design, how we approach behavioral health can be very scary, especially when there's so much mistrust, right? Take out the language and all of that too. It's like, why am I going to talk to this stranger? I think there's value in both. I remember in undergrad, have, like obsessive compulsive, right? Everything has to be perfect. So they had asked me, do you want to see a provider who is Asian? And I was like, oh, heck no, do not give me an Asian person, whatever you do. I don't care if they're not from Laos. Like, I don't want to see any Asian person because that was my own internalized stuff, right? That's my own stuff I got to work through because I'm afraid that they're going to judge me, right? And again, it's because I don't have a connection with them, right? So I just wanted to kind of put that in there too. It's a covered benefit. Go out there and ask about it. You could do it over the phone even, right? Health. But also like recognizing for my white brothers and sisters out there who have control and influence in changing systems, while I also have that privilege and others do as well, my white counterparts really have a different way of being able to move that needle. So I hope that you can hear my heart again in saying that there is opportunity here for us to connect and help our communities. And it's going to take time, right? When we talk about equity, it's oftentimes thought of as an add-on, like, how can we think of equity as just important as safety or compliance, right? I hear my colleagues too say compliance is everyone's responsibility. Well, equity is as well, right? So how do we take that time to really learn from community about what is happening, but not just learn from them and then take their ideas and go create something and fix it. Really invite them to the table and co-create together. And that stuff really takes some patience, presence, some really strong listening skills, and just this vulnerability of being able to just kind of hear one another, right? I can go on for days. You all know that. But I just wanted to make that plug that mental health is covered. And health systems are really open to hearing, like, what could it look like? Right? Yeah. I mean, our governor here in Oregon, has a governor's behavioral health advisory council, that I've been really privileged to be a part of. And I mean, there's a lot of effort happening.
Mm-hmm. Yeah, thank you for sharing that. And that actually this goes into, again, that foot you have on both sides, bridging the opportunity. I love that you mentioned that and change bridging the gap to bridging the opportunity. You've got that foot in the community and platforms like this where you can spread that knowledge. And then you've also got a foot in the healthcare system where you have that knowledge, and you can share it. It brings me to a previous conversation that we had about when was that moment, and it's probably more than one, a couple of different times that you had this eye-opening feeling and this realization or an epiphany, whatever words you want to use, where you realize that the healthcare system was different for different people based off of their color, their culture, their background. And you have both shared with me kind of some things leading up to this that made you realize, wait a second, it's different for everyone else than it is for me. And I loved what you guys both shared because talk as a woman of color and a refugee, your experience is completely different than Eric's as a white male. But both of you had these moments where your perspective was changed. Can you share a little bit about that with me, Eric? I'm going to put you on the spot and have you go first.
Sure. Yeah. So I mean, that's a really big question, and difficult to talk about live to the world, and admitting ignorance. But I think that's kind of the point, and what makes it so difficult for communities to come together and talk through this. So just to take you through a quick, couple minute Eric journey here. So I grew up in a small town in Oregon called Woodburn. If you're not familiar with Woodburn, it's a large part of the economy before the outlet mall came in. It was based on agriculture and migrant farming. And so during the farming season, several families and communities would come up, farm, and then come back down when it's not in season. And so I felt like at that time I grew up in a really diverse, wonderful community. There were definitely, different circles that I wasn't a part of. But Jess, we've talked about this before. History books are pretty skewed in favor of, a very specific paradigm. And so, when I learned about things like, the Tuskegee trials, and it all really felt like, well, that was American history. That was, in the past, and then everything that I experienced in my very small town, and not getting out and experiencing the rest of the world. That was it. And so, we talked about, bridging the gap between speaking Spanish or English, and, we'd have Heritage Day in elementary school. And I'm like, well, I guess maybe Norwegian. Maybe I'll talk about Vikings. That will probably be the right, that's probably what the teacher is looking for. But I was so sheltered, and I didn't realize this until, I left for college, went to Oregon State. My world got bigger. There's a lot more communities. I saw a lot of terrible actions that I wasn't used to. I heard a lot of terrible things that I hadn't learned up until that point in my life. But it wasn't until I took the first of several ethics classes, and on very first day, before we even talked about syllabus, my ethics professor says, if you're white, you're racist. And I threw my hands up in my head. I said in my head, this can't be right. Okay, this, hold up, let's call off the dogs here. And then of course we got into privilege, and specifically white supremacy, and growing up with those advantages. And from my small bubble, I didn't realize that was ever anything that I had been spoiled with. I think spoiled is the right term here. And going beyond that, every day I learned something new prepping for this webinar. I came into this webinar saying, all right, guys, talking points. What's the takeaway? How do we, what do we want to give people to get them from A to B? And I didn't know at the time then that was such an ignorant comment, because it's not, we are building a bridge, but we don't build the bridge and then the world is fixed. This is an ongoing thing that gets bigger the more you study it. So, I guess ongoing, but that first ethics class, really kicked me on my butt, and I've been growing ever since.
Yeah. And thanks, Eric, for sharing, because I know that was a fear of yours to, admit that you've got this naivety for such a long time until you hit college. But that's what we need is honesty. It's upfront. It's organic conversation. And so I really, really appreciate you sharing that. We've got about 4 minutes left for this conversation before we open it up to questions. I really want to hear. I wanted to hear about your history coming in and all the places that you lived and those moments. But I'm going to shift gears a little bit for you, and I'm going to challenge you to talk a little bit about your family in terms of when some of these things came up that were eye-opening for you. I think Eric just shared a couple tough things, and I know this is a tough topic for you. But again, something that I think is so valid.
Yeah, I appreciate that, Jessica. And thank you again, Eric, for being so bold. I've had a lot of learnings, right? A lot of pivotal moments in my life. And as I mentioned much earlier, I've been a fierce advocate for refugees, right? That's the lens I move throughout the world in. And I've seen the sacrifices that refugees have made, both, internationally and nationally. And I've always just felt like that's what I've got to go for, is fight for refugees, right? And everybody else is, they've got their struggles too, but this is my responsibility. I owe that to my ancestors, right? And then I meet my husband, who I met back in 1999, a little over 20 years ago, who is a Black man born and raised in a very small town called Cheraw, South Carolina, where the Confederate flag was all over the place when I went down there. And even then, I was like, what? I thought I at least learned about slavery in the 3 chapters I had in high school. And I'll say that again, 3 chapters. And when I met him, and of course, I grew up in Fresno, California, around other Southeast Asian refugees, other Black Americans, other Latinx communities. We lived in poverty. We lived in Section 8 housing. Back then, we called it the projects, right? I know now that's not an appropriate word. But so it's not the first Black person I've met, but it was something really interesting when we met, and he taught me about things that made me go, hold up. This fight that I'm doing for refugees, there's other people who have been fighting for so long, way before we came to the U.S., and that is our Black brothers and sisters, right? It's like I had to really sit and not understand, because I'll never understand what it's like, but dig a little deeper and be uncomfortable with slavery. Like, he sat me down and watched Ruth. Our discussions are always about race, and it can be really tiring and painful and ugly, but we have to have it. Because what he's always taught me is about the system and how it's structured. Growing up in the Deep South, going to a historically Black college and university, right, an HBCU, being part of a Black fraternity, he opened my eyes to a world so much bigger than what I thought was big enough. And till this day, with everything that's happening after George Floyd was murdered, I looked to him and I said, how are you, right? And he looked at me and he said, this is no different than every day that I live as a Black man. And even then, I'm like, yeah, but this is different. He's like, it's not. Growing up, the face of Emmett Till stayed with me and will stay with me for the rest of my life, right? Living through the Atlanta child murders. I'm like, what's that? Googling it, right? James Baldwin, Jim Crow. I'm like, oh my God, if I were 20 years younger, this is where I think, again, there is opportunity for our educational system to really step in and help our generation really learn about it, come closer to it. I get that it's painful and I get that it's ugly, but if we don't accept that has happened and that we all have a responsibility, me included, even as somebody who is of color, to help dismantle it, then we're going to stay here in this really ugly place where there is no movement, just talk of movement. So in a nutshell, my husband my in-laws, my family, that are Black American have really continued to help me learn about the fight that our Black brothers and sisters have been having for so long. And I shake thinking about it just because it is. I cannot believe that our country treated and continues to treat Black people like they're disposable. And I want to call out, one of my favorite trauma teachers, Resma Menakem. He talks about the power of white skin, and I didn't understand that. I didn't understand the power of white skin and what that does when white skin shows up into a meeting. Whether my white brothers and sisters want to believe it or not, there's so much power in how you all show up, while I sit here and have to code switch every day just to keep up. So, I continue to learn every day, and I have to be open to sitting with that discomfort and recognizing that while I'm fighting for refugees and our limited English proficient English language learner communities and our immigrant communities, there's so much more fighting that we have to do, and we should have to fight, right?
Yeah, thank you, Talk.
That was more than 4 minutes.
It was more than 4 minutes, but it was well worth it. So, yeah, storytelling and circling back, that was beautiful. I want to thank you both for your time and your input. And I want to just say a couple of the names that you mentioned and a couple of the errors that you mentioned in this last topic right now. James Baldwin, Jim Crow, the Atlanta child murders, Emmett Till, Resma Menakem, excuse me. I want to make sure that those were captured by our audience, because those are all really good resources and people and eras to look up if you don't already know who or what they are. We talked about how there aren't any takeaways. There's no bullet point takeaways. That this is more of a conversation, because we can't have a solution if we don't first identify the problem. And there's definitely a big problem in our healthcare industry and finding equity. We're not going to do that on a 45-minute conversation, but we're having open dialogue. That's my favorite thing to do, open dialogue and talking honestly together. We're doing it freaking live right now. So if we can't get any more honest than that, okay? So we need to continue this and challenge everyone to continue the conversation. We've got about 6 minutes left. I don't know if we get timed down on this webinar or what, but Eric, do you have any insight to if we've got any questions that we need to answer?
Yeah, absolutely. So for those of you that have some burning questions, feel free to throw them in GoToMeeting or GoToWebinar rather. We're happy to get to them. There have been a few questions that have come up that are pretty specific to those interactions that they have with us at Linguava. There was a really good point that was brought up, and it was coming back to when we were talking about working with interpreters in a healthcare space and working with the limited English proficient or LEP community. And it's just surrounding, how that really works to have interpreters to provide language access. So I'm going to reach back out with that woman soon, but I just kind of wanted to touch, in case that's something that a lot of people are struggling with or still trying to conceptualize. Again, adding the Eric perspective, right? From my side, this is first world problems. This is white privilege. Okay, so let me just put that disclaimer up here. This would be similar to have you found everything okay at the grocery store, and you instantly say okay because you're a self-sufficient person. Okay, so that's the white privilege version of what this looks like. And then when you add terribly ignorant comments or people, or learn to speak English, or the fear of being deported in the current political stand that we're in right now, asking for help is so incredibly difficult, with those communities. And so I think that's really important to touch on. So we can't rely on the limited English proficient communities to be the ones to start that conversation. It is our responsibility to proactively reach out. And something we talk about a lot is that smile and nod is a really difficult thing that we do as Americans, because it can express a lot more comprehension than what is actually happening. So I'll take that offline with that asker, but I just really wanted to put a bullet point there as we are talking about bridging the gap in communication. There, it's our responsibility, not theirs. We should be giving help and not waiting for people to ask. So
absolutely, that was a good explanation right there.
Yeah.
Is that the only question that felt relevant to go live with?
Other than
answer any questions after this as well.
Yeah, other than that, it's been a lot of affirmation, and I'll share that with Jessica and talk later. But I can't thank you all for the support. And again, it is about being vulnerable, and so that's what a lot of the comments are about. In fact, I'd love to leave on a quote if that helps. I think this has been, in particular, really important for me. Just like you mentioned, we've worked together. We worked together at a different company. We've learned a lot together, and of course, we've had our life experiences before that. But even just in the roughly 12 hours talking through this stuff and really trying to get some of our thoughts down, it's been really difficult for me. I know it's been really difficult for the two of you, and I think this is a big reason why we're still so far behind in the progress that we should have made up to this point. And I think that's really important to talk about. So I found this quote from Sonia Gupta, and I want to just read it. This is for everybody, not only that looks like me, but still wants to grow in their conversation. And speaking for myself and probably Jess and Talk, we hope that you take this and continue to grow in your journey. It's not a destination. I haven't arrived. Let's be fair. But I'm doing my best, and as we all should be. So here's the quote. Unlearning white supremacy isn't Instagrammable. It's deeply personal, existential, and difficult work. It often feels horrible. It will make you cry. I can attest to that one. You might become depressed. It can be very isolating. It will shatter your ego and your belief system. Do it anyway. And so that's where I'm at in this journey, and I wanted to end on that note.
Wow, what a beautiful, beautiful quote to share. Thank you, Eric, and thank you, Talk, so much for this conversation.
I've heard that quote many times, and every time I hear it, it's like the first time.
Yeah, same.
Yeah. Thank you so much to everybody who took the time, and I say this often to my friends and my family is, thank you so much for taking the time out of your day, out of your headspace, and out of your heart to sit with us for an hour, stay here with us, talk about, something that is really big. And I hope that you all can continue to do this among your friends, your family, and in your workplace. It doesn't need to be big. Just continuing to talk about it. Keep it right there in that forefront,
Yeah, thank you both, and thank you to everyone that joined us. And we will see you next time.